Chapter 8. Chapter 8 is Understanding Drug Labels. Again, this is a really good read, so I need you to read this chapter and learn it. Whenever we talk about drug labels, we talk about brand name, trade, manufacturers, generic. So read that. I'm going to jump straight into drug labels so we can just get the ideas of it without reading all of this. So we have the NDC code. It's the National Drug Code. You can take the NDC and the number here and type it in the database and it will pull up the drug medication. This is important. And then the name brand, the brand name, trade name, is usually the most dominant of the print here, most of the time anyways. And most of the time it follows with a little circle with the R inside of it, which is hard to see because it's so tiny on this. It's not always there, but most of the time that's what you see by it. The generic name is usually like smaller and it's towards the bottom underneath it, or say towards the bottom of the brand name. And from what I've read from the text and software, I understand that the majority of the drug labels that has a brand name has a following by the generic. Now, every now and then you're going to find one that don't. So when we talk about amount versus volume, this is an amount because the grand total is 120 tablets. I can count the tablets, pull them apart and separate them and count them, so it's amount. If it was in milliliters, we'd call it volume. This here is the directions. This here tells you how to store it. Sometimes it has more directions over here. If the patient is a certain age, give them this much. If it's patient's this age, give them this much. Calculate based upon this. I mean, so these instructions are very important. Here's the manufacturer with their address right here. Here is the barcode. It usually has a lot number and expiration, but on this one here, it doesn't have an expiration. And most of the ones that you'll see in this class won't have an expiration date. So here is an injection, and this one shows you a reconstitution. So it shows you a new dosage strength based upon how you reconstitute it. If it says, most of the time it'll tell you if it's a single or multiple dosage use. In this case here, I don't see where it says it anywhere on here. The directions are important. It tells you where to store it. Here's the NDC code. This is a volume because it's measured in milliliters, and I was trying to find it. Oh yeah, it'd be based upon these here, right here. This one here means we're going to reconstitute it. It could be a powder form and we're mixing it with water, or not water, but dilute it. Or it could be liquid, mixing it with another liquid. Here is our, I believe, barcode. Here is the 1 million. It says it's for injection. Sometimes it tells you where, like intravenous or intramuscular, subcute. Here is our brand name. And there's this R in the circle. And here's the publisher, the manufacturer, I mean. And on a reconstituted one, you always put the patient's name, the room, and the date diluted. And sometimes the dilution of it is only good for 7 days or whatever it may be. And you have to put the expiration date and your signature. Also, if it's a single or multiple dose, you still have to have some kind of documentation. I wanted to come back to this one because something I didn't say is the dosage strength. We know the dosage. The dosage is tablets, right? And the strength is 1 gram. So this says that for every 1 gram, we have 1 tablet. Or another way to say 1 gram per tablet. Okay? And let's do one more. And again, this one here is a amount, because I can count it, 60 tablets. Here's our NDC code. Here is our barcode, our lot number, expiration. Of course, in this one here, it's different because it's just it's for this class only. Here is the brand name, and the dosage strength would be 250 milligrams per tablet. Here's the directions. Here is the manufacturer. So I encourage you to read this chapter, go over the labels and make sure that you understand them. Here is another one. This is a volume. We have 10 milligrams per milliliter. This here is the dosage strength. This here is the volume, 60 milliliters for this whole thing. So we have our strength and we have our dosage. It's oral, so it's oral suspension. We're going to use this dropper, the brand name, instructions. Sometimes they're inside. Expiration date, lot number. Here's the barcode. Usually it has a number with it. Here's the manufacturer. So for this class here, you need to be able to determine what is the dosage strength, what is the amount. Oh, here's our NDC code. What's the brand name? And when we have to do reconstitution, you have to be able to figure that out as well, which I'm going to do videos and go over that with you pretty soon. So please be sure and read this chapter, understand it. It's telling you about single and multiple doses. And that is it for chapter 8, other than please be careful and watch out for alerts, label alerts. 6 rights is still very important. And thank you.